I would like to ask a few questions to Dr. Shi and also Dr. She, because I know you are in the first affiliated hospital to Xi'an Jiaotong University, and you have extensive experiences in treating patients with COVID-19. So my question is, first of all, can you just introduce to us briefly about how the hospitals, not only here in China, but also in African countries, can help to resume their operation after, being impacted by the pandemic. And now, because now we have so many businesses and companies in China, in Africa, especially in African countries now, trying hard to resume their supply chain, their production. Do you have any suggestions for them from a medical perspective? 那我现在也问一下咱们的施院长，还有这个佘院助，就是我们一个是呢，不光是现在这个中国的医院，可能我们已经过了这个阶段，但是很多非洲的国家，他们是现在去要面临一个医院的重新的复工复产，还有一些其他的公司啊，然后其他的商业也是有这个复工复产的问题。所以您能不能从这个专业的角度来跟我们分享一下这方面的经验呢？施院长您先请回答，谢谢。
主持人好，赞比亚的朋友，大家好，这个非常高兴在这跟大家来交流，医院复工复产的情况。因为我们医院现在还肩负着外籍人士的这个定点医院，我们经常一些外籍人士到我们医院来看病，所以呢，我们的复工复产的这样一个任务还是比较复杂的。但是呢，我们最近呢一直在做复工复产，我们现在呢基本的医疗的量呢已经，sorry，
没问题，您请继续讲，或者我们的 translate， 或者您说完这一段，我们请我们的翻译来翻译，您可以再继续讲一点，谢谢。
前面你们听到了吗？我好像
全部听到了，没问题的，您的声音很好。
OK， 所以呢，这个我们现在呢，这个形势比较复杂，但是我们经过前面努力以后，现在呢，基本恢复到了我们原来疫情前的95%以上的这样一个工作的情况，所以呢，也基本上恢复到了我们疫情的情况。这里面呢，我们有几点做法。那么第一点呢，就是我们仍然把我们的感染科，也就是我们的传染科，病房完全空出来，作为我们应急可能发生病人来住院的地方。那么同时呢，我们传染科的所有的工作人员，或者呢在我们的发热门诊，或者在我们医院里面来协助其他科室来做好防疫的工作。请翻译。
院长您先暂停一下。好嘞，谢谢您。
Thank you very much. It is really an opportunity for me. I wish the moderator and friends from Zambia good day. And as a hospital director, I think our hospital also shoulder the responsibilities to take in some of the foreign residents in China. And currently, I think the situation is quite complicated in our hospital. We have resumed 95% of our hospital operation load compared with before the COVID-19 outbreak. And I think we have also emptied our infectious disease department as an emergency area if there is another surge of the COVID-19 outbreak. And for the doctors working in the infectious disease area, we actually reassign them to other different outpatient department and inpatient department to help the doctors from other different departments to better treat the other patient and also to prevent and control the outbreak of COVID-19.
那么为了使我们更多的病人能够在医院得到救治，那么也避免我们平时太多的病人来到医院，所以呢，我们提出了另外一个非常重要的一个活动，就是淡化节假日，特别是我们现在周六呢，基本处于一个正常的工作状态，我们也把它叫周六这个医疗。那么这一天，我们所有的临床科室完全开放。所有的功能科室开放，那么同时呢，我们其他的相关科室也是完全开放，所以这就保证了我们每一天又多了一个正常的工作日，这样的话不至于太多的病人在平时的这个时间运到医院来，造成医院呢比较这个人员拥挤的情况。
And in order to let the patients be treated. And we also don't want to see the hospitals are overwhelmed. So we also have another initiative is that we make Saturday also as our working day. So which means we work 6 days per week. So basically on Saturdays, a majority of the departments actually open to provide services so that also avoid overcrowded in the hospitals.
另外呢，就是我们充分的发挥了我们整个医院这个平台的一些作用。那么这些平台呢，比方说 CT 磁共振、超声以及我们这个检验。平时呢，这些科室因为比较多，有的时候呢，病人需要预约等的时间比较长，所以呢，我们现在呢，经过一定的流程的优化，另外呢，通过增加人员等等，那么使这些部门呢更好的发挥作用。那么我们的门诊病人现在基本上都可以当天把这些检查做完。那么住院病人呢，也是大大的缩短了病人等待的时间，这样呢就保证整个医院的高效率的运行。
And another thing is that we give full play to our different platforms, which means we increase the working efficiency in different testing departments like CT or ultrasound testing, as well as NMRs. So we either actually streamline the whole working process or add more headcounts. So for the outpatients, so they can finish all the needed tests on the same day when they visit the hospital. For inpatients, they shortened their waiting time.
那么还有一点很重要的呢，就是我们医院呢现在有一个非常成熟的网络医院。那么这个网络医院已经在我们医院运行了1年多，大概有1年半的样子。那么这一次网络医院在我们疫情期间发挥了很好的作用。那么我们继续呢充分的发挥网络医院一个作用。第一呢，就把现在对我们医院医疗需求的增量基本都放到了网络医院。那么第二呢，就是我们也鼓励更多的患者来到网络医院来，这样的话避免他们到病人来发生拥挤。同时呢，通过网络医院这样信息的一个强大的作用，和我们医院因为可以完全无缝连接，所以呢，使更多的，比方说我们的一些辅助检查，这些都可以通过预约来到医院来进行检查看病，所以是医院的整个的流程也发生了非常好的一个变化。
Another key initiative we are working right now is we would like to give a bigger role to our network hospital or virtual hospital that played already the key role in the COVID-19 period. So basically, we channeled our patients first go to the virtual hospitals. They can make appointments or they can get the services already online, so they not really need to pay a visit to the hospital. So for patients who need to do tests, they can first book an appointment online and then go to the hospital, which also can help us to control the traffic in the hospital. That also help us to increase our working efficiency.